Do you avoid eggs because of cholesterol? Do you think all cholesterol is bad? Are you confused about what you can and cannot eat? I'm Dr. Emily Carter, a therapist and gerontologist, and today I'm going to tell you the truth about cholesterol. The truth that might surprise you. The truth about what really raises your cholesterol, what foods are actually safe, and when you really need medication. This information could save your life. Let me start with something that might shock you. For decades, doctors told people to avoid eggs, butter, and other high cholesterol foods. Millions of people stopped eating eggs. And guess what? Heart disease rates didn't go down. In fact, they went up. Why? Because we were focusing on the wrong thing. The cholesterol you eat is not the main problem. The cholesterol your body makes is the problem. And what makes your body produce too much cholesterol? Sugar, refined carbohydrates, trans fats, processed foods. Not eggs, not butter from healthy cows, not shellfish. But before I explain what you should and shouldn't eat, let me explain what cholesterol actually is and why you need it. Cholesterol is not poison. It's not the enemy. Cholesterol is essential for life. Your body needs cholesterol to make cell membranes, to produce hormones like testosterone and estrogen, to make vitamin D, to produce bile acids that help you digest fat. Your brain is 25% cholesterol. You cannot live without cholesterol. The problem is not cholesterol itself. The problem is having too much of the wrong type or too little of the right type and having it in the wrong places. Let me explain the different types of cholesterol. This is important to understand. Total cholesterol is just a number that includes everything. It's not very useful by itself. What matters are the different types. LDL cholesterol. This is called low-density lipoprotein. People call it bad cholesterol, but even this is too simple. LDL carries cholesterol from your liver to your cells. You need this. The problem is when you have too much LDL, especially small, dense LDL particles. These can get stuck in your artery walls and cause plaque buildup. HDL cholesterol. This is called high-density lipoprotein. People call it good cholesterol. HDL carries cholesterol away from your arteries back to your liver. It cleans up excess cholesterol. You want high HDL. Triglycerides. These are not cholesterol. They're fat in your blood. But they're measured in the same test. High triglycerides are very dangerous. They increase heart disease risk significantly. VLDL cholesterol. This is very low-density lipoprotein. It carries triglycerides. Also not good when it's high. Now here are the numbers you need to know. Total cholesterol. Optimal is below 5.2 millimoles per liter. That's below 200 milligrams per deciliter in American units. Borderline high is 5.2 to 6.2. High is above 6.2. But remember, total cholesterol alone doesn't tell the whole story. You need to look at the breakdown. LDL cholesterol. Optimal is below 2.6 millimoles. That's below 100 milligrams. If you have heart disease or diabetes, optimal is even lower, below 1.8. Near optimal is 2.6 to 3.3. Borderline high is 3.4 to 4.1. High is 4.1 to 4.9. Very high is above 4.9. HDL cholesterol. For men, you want above 1.0 millimoles. That's above 40 milligrams. For women, above 1.3 millimoles. That's above 50 milligrams. Higher is better. Above 1.6 is protective against heart disease. Triglycerides. Normal is below 1.7 millimoles. That's below 150 milligrams. Borderline high is 1.7 to 2.2. High is 2.3 to 5.6. Very high is above 5.6. There's also another important ratio. Total cholesterol divided by HDL. You want this ratio below 3.5. The lower, the better. Now let me tell you what really raises your cholesterol. This is where most people get it wrong. Number 1, sugar and refined carbohydrates. This is the biggest factor. When you eat sugar, white bread, white rice, pastries, your liver converts the excess sugar into triglycerides and VLDL cholesterol. Sugar raises triglycerides more than fat does. Let me repeat that. Sugar raises your triglycerides and bad cholesterol more than eating fat does. Number 2, trans fats. These are in partially hydrogenated oils, fried foods, packaged baked goods, margarine, shortening, many processed snacks. Trans fats raise LDL and lower HDL, the worst combination. They're banned in some countries now, but still common in others. Number 3, excess omega-6 oils. Soybean oil, corn oil, sunflower oil, safflower oil. These are in almost all processed foods and restaurant foods. They cause inflammation and oxidize LDL cholesterol, making it more dangerous. Number 4, being overweight, especially belly fat. Visceral fat increases triglycerides and lowers HDL. Number 5, physical inactivity. Not moving enough lowers your HDL and raises triglycerides. Number 6, smoking. It lowers HDL and damages artery walls. Number 7, excessive alcohol. More than 1 to 2 drinks per day raises triglycerides. Number 8, chronic stress. Stress hormones can raise cholesterol. Number 9, certain medications. Steroids, some blood pressure medications, immunosuppressants. Number 10, genetics. Some people have familial hypercholesterolemia. Their body produces too much cholesterol regardless of diet. This is serious and needs treatment. Now let me tell you what does not significantly raise your cholesterol. This will surprise many people. Dietary cholesterol from whole foods, eggs, shellfish, organ meats. For most people, eating these foods does not raise blood cholesterol significantly. Why? Because when you eat cholesterol, your liver produces less. Your body regulates it. Studies show that eating up to 3 eggs per day does not increase heart disease risk in healthy people. Saturated fat from whole foods. This one is controversial. For years, we were told saturated fat is terrible. But recent research shows it's more complex. Saturated fat from whole foods like butter from grass-fed cows, coconut oil, fatty cuts of good quality meat, does raise LDL, but it often raises the large fluffy LDL particles, which are less dangerous. It also raises HDL, the good cholesterol. The real issue is not saturated fat by itself. It's saturated fat combined with sugar and refined carbs. That combination is terrible. Now let me tell you exactly what you should eat to improve your cholesterol, foods that lower LDL and raise HDL. Number 1, fatty fish. Salmon, mackerel, sardines, herring. These are rich in omega-3 fatty acids. Omega-3s lower triglycerides, reduce inflammation, and improve the LDL to HDL ratio. Eat fatty fish at least 2 to 3 times per week. If you don't like fish, take a high-quality fish oil supplement. Number 2, nuts. Almonds, walnuts, pistachios, pecans. Studies show that eating a handful of nuts daily lowers LDL by 5 to 10%. Walnuts are especially good because they have omega-3s. But watch portions. A handful is about 30 grams, 1 ounce. Nuts are calorie-dense. Number 3, olive oil. Extra virgin olive oil. Rich in monounsaturated fats and antioxidants. It lowers LDL and raises HDL. Use it for salad dressings, drizzle on vegetables, cook at low to medium heat. 2 to 3 tablespoons per day is beneficial.